myself?
You look good, sis. You look good. All right. Good morning, good afternoon, good evening, depending on when you're watching. This is the face and the voice of Dr. Olabintan of Livingspring Family Medical Center here in Mansfield, Texas, where we believe in helping our patients live long and well because we believe that the quality of life is just as important as the quantity of life. And I'm really excited to be here today with my friend, Dr. Esthetician, struggled there a little bit, Dr. Yinka Dosunmu, who's here, and we're going to be talking about how to keep your skin aglow. She's also the founder of the DYS Skin product, and I'm going to let her introduce herself, but I'm really excited to be here today. Thank you, Dr. Yinka, for gracing us with your presence. It's nice to see you. You look fabulous. You look
Hi, Dr. O.
you look good. You look good. So for
Thank
those
you.
and who are watching replay, please kindly introduce yourself. Who are you and what do you do?
Thank you, Dr. O. Thanks for having me. I see all the great work you're doing, and I'm just bowled over. You're amazing. You're
Thank you.
amazing.
Thank you.
So, my name is Dr. Yinka, and I am a family physician. So, in the North Americans, it will be family physician. In the UK, we're called general practitioners. And I have been a doctor since 2004. Like, I left medical school in 2004. That's a lifetime away. And so I've practiced in the UK and now practice in Canada. And I've got a skincare line called DYS, Dr. Yinka Skin. And essentially it's aimed at the skin of color because I've always felt we were underrepresented. And even products that were good for us, we didn't know if they were good for us, if is this the right thing for us. So that is what I do, and that's my passion, skincare.
Awesome. And obviously, I mean, we can kind of tell because your skin is literally glowing. So you mirror what you're about in that sense. So awesome. Now, why do you do what you do? For those who are wondering, I don't know if you have a story behind why you do and how you branched off to doing skincare.
Okay. So the story is that when I finished my family medicine training, I had a great trainer, and he wanted to expose me to different parts of medicine in the world. And one
Okay.
of the things he talked to me about was aesthetics, right? So, but his angle was injections. And I started with the injections, the anti-wrinkle injections and the fillers. But
Okay.
every time I went, I would get those woman of color asking, "What do I do for my skin? How do I look after my skin?" And it became a constant question. So I decided to start doing Facebook Lives to talk about how to look after your skin. And then other things happened where, in wanting to talk about the skin, I was going for training. So I was going for extra training because this is not what you learn in medical school, right? No one teaches you skincare. Yeah, in medical school.
Right.
So I decided to kind of train up, and I would go for these courses, and they would say things that uh, any black woman on the street would know. For example, I would hear all the time, "You can have hydroquinone for as long as you liked." I'm like, that's not true. And you're trying to say it's not true, but you're a student, you're here to learn. So that was an issue until I realized maybe they don't know that much. Maybe I need to do the studying and put the words out. I would put the word out there. And from there, that's how the products were born. Because when I did the talks, people were like, "So what do we use? What do we buy? Where are these products?" And that's how this line was born.
Awesome. Awesome. Dr. Una is watching, by the way. She says hi.
I can't see the people watching.
All right, go ahead. Now, for those who are watching who are wondering what hydroquinone is a skin lightener, and that if used inappropriately can actually cause different variations in the skin and actually cause skin damage. So it's not something to use just willy-nilly like that, for lack of a better word. Thank you for highlighting that. Now, Doc, let's go right into it. Let's talk preventive measures. As family physicians, we're big on prevention or managing of chronic illnesses, and making sure things will become worse by doing certain things ahead of time, right? So that's why it's called preventive. So what are 4 to 5 tips on how to prevent skin damage? What would you say?
Okay. So the good thing about this is that whatever looks after your kidney, whatever looks after your heart, whatever looks after your big organs, your liver is good for your skin. I knew you would like that.
I love it. I love it. I gotta write that down. That's good.
You're taking notes, huh, Doctor?
Notes.
Yeah.
Uh-huh.
So like eating healthy is good for you, like like a diet good in all the good stuff, a Mediterranean diet. Or I think I've heard you talk about the DASH diet, the one for hypertension. So lots of green vegetables, reduced alcohol, reduced caffeine. The thing, when you're looking after your heart, you're looking after your skin, right? You're staying hydrated, right? Because the skin will grab some of that moisture. So it grabs some of the moisture from inside and some of the moisture from outside. So that's why when you go on holiday to the beach on in a really humid country, people always come and say, "Oh, my skin glows." People say, "Have you been on holiday?" Like, have you heard that? Have you been on holiday? Because when you go away to somewhere, somewhere humid and warm, your skin grabs that moisture from the air and pumps it in, and it makes your skin look healthy. So that's one thing. All the good things are good for you. Eat healthy, exercise. When you exercise, you sweat. What are you sweating? Isn't that like the best moisturizer for the skin? That's like essentially putting water
Girl,
on
you
your.
are dropping gold. Thank you.
So that is good. So also that's another thing. People that exercise, I mean, a few groups of people that exercise, and they always say one of the things that I got from exercising that I never expected to get was my skin got better. So for example, let's say people that have a condition called polycystic ovaries, where sometimes it affects their skin. Losing weight sometimes helps polycystic ovaries, hence helping the skin. So that those are things you can do every day. So when you do that, you're helping lots of the organs. And never forget, the skin is the largest organ we've got. Is the first one people judge you by. No one looks at you like, "Oh, I don't like the way your liver looks. Oh, your liver looks odd." No one ever says that. No one ever says,
Kidney's a little stale today. What's going on?
"Yeah, what's going on?" Or they'll say, "Oh, your liver's glowing," in the words of Dr. O, like, "Oh, look at you, that heart's glowing today." No one's going to say that. But when they see your skin, they're like, "Oh, you look a bit this, or you look a bit, or you're glowing. So they judge you easily by your skin. So looking after your skin equals looking after all the organs. And the second thing I want to talk about is sun protection. Listen, we people of color of all variations, we're terrible like this. I've been talking about sun protection for years, and I still get fightbacks and people saying, "No, we don't need it because we have melanin."
Or don't think that they tune out. You know how you're telling someone something, but they already have a construct like, yeah, that doesn't apply to me, so you tune out. I used to be like that too. I would, yeah, sunscreen. Yeah, not. I don't think she looked at my skin. Right, but I found that to be very, very true. So I just wanted to highlight that. Please go ahead.
Yeah, it's true because and I think sometimes what I've also enjoyed by my conversations is people are like, "Oh, she looks like me. She says she used sunscreen. Okay, what's she saying? Now let me listen." I wasn't listening when the other person was saying it. And if this woman uses sunscreen, why doesn't she look white, casty, ghosty, avatar person? Why does she look normal? So if there's anything else, if there's nothing else you hear from me, because Dr. O is going to talk about all the healthy food and exercise and all that, but at least I'll talk about sunscreen. I'll say if you hear nothing, use the sunscreen every day. Now there's always the debate about should it be physical or chemical or this or that. It doesn't matter. Use the sunscreen that works for you. I mean, there's a whole hours discussion on physical versus chemical sunscreen, but use the one that works for you. If you prefer physical, because there's kind of like a TikTok buzz at the moment about physical sunscreen, that's fine. The DYS sunscreen is a physical sunscreen, so if that makes you feel safer, it was done with that in mind as well, because people tend to view them better. So use sunscreen and use it every day, every day. Sun, winter, every day. Just use it. And I think for me, and the other thing is, if you have an injury, try and treat it early. If you have an acne, try and treat it early, because those things, when they scar, it's harder to treat. Scars are harder to treat than whatever the cause of the scar is. So if you have an injury, make sure you clean it, make sure you put some band-aid on it, make sure you massage it with oil, put some vitamin C serum, things that help it heal. If you've got acne, start treating really early so it doesn't scar, because scars are harder to treat.
All right, Dr. Yinka, by the way, a lot of comments are coming in. First, a comment on the avatar face that was gold. So thank you for that laugh. That was good. And then I have a question from someone here, Dr. Mitra, who is asking, and hi, thank you for joining, Dr. Mitra. And she's asking, do you change the type of sunscreen based on the type of outdoor activity? So is there a need to do that, do you think?
Yes. So it depends. Some people would have one of those mist ones when they're outdoors because it's easier.
Okay.
Now, so Dr. Mitra, is a very interesting question that you can say yes and no, and it's very dependent on the person. So, for example, for me, I sometimes say I make products for myself for what works for me. I know I will not change my sunscreen. I know I will not change my sunscreen. I know I won't go look for a spray at a different time, an SPF 30 at a different time. So I made a sunscreen that works for me, that I can use every day, whether I'm going in the pool, whether it's in the winter, whether it's in the summer. So the DYI sunscreen is an SPF 50, right? And it's broad spectrum. So you can use it every day. It hydrates. But some people would find that maybe in the winter months when the sun is not so high, they want to use an SPF 30 and then change it in the summer. That's fine as well. I really don't care, Dr. Mitra. I do not care. As long as you use it every day, I don't care. If you want to use a spray one, you want to use, I don't care. Just use it every day. Just use it every day. If some people, like, I've gone into someone's home and she says, come in my bathroom. I went in her bathroom. This woman's an addict. She needs to go into rehab. Her bathroom was full of all kinds of skincare products, like the most amazing. She just loves them. The way people collect shoes, this woman collects skincare products. And there are people like that. There are people like that. And they love it. And I do not grudge them at all. Enjoy it. Just use the things that you know that work and use it consistently. So the answer is yes, you can change based on what you fancy. You want to use a spray, you want to use an oil, you want to do this, you want to do that. And that's fine. Just use it every day. If you prefer to use the same one all the time, then find one that you love and stick to it.
Find one that you love and stick to it. Man, I need to type faster. The comments are really good. I wish you could see this. But Dr. Mitra says, fantastic. Thank you. And she says, sunscreen skincare we have. All right. Awesome. So next, and for those who are watching, you could go back and rewind after this is done and take the notes again. She talked about exercise. She talked about eating well. She talks about hydrating. She talks about sunscreen. So many things to do, and treating injuries to your skin early. All right. Next, how do people unknowingly damage their skin? Now, you've alluded to some of them before, not having sunscreen. But aside from that, how do people unknowingly damage their skin?
Okay. So I want to say this because this is kind of a passionate thing. I know we mentioned it at the beginning, but I plan to say at this time, Dr. O, there's a study that came out recently that said 70%, 70, of Nigerian women bleach their skin.
Oh yeah, yeah. Embarrassing fact. Yes, but it is true, and I think it holds true even across other nationalities too.
Yes.
Yeah.
So this was a study in Africa, I think. I'm trying to remember because it was all African countries that was listed. 70% of Nigerian women bleach their skin. The same problem in the Indian subcontinent. The same problem, like so many places where we are using all kinds of harsh things on our skin to that causes long-term damage. So this skin bleaching thing, I really need to get down and do this talk because I want to talk about the economics of it, the psychology of it, the health care aspect of it. It just is just such a huge topic. The many times these people are not bleaching their skin because they want to look white. Sometimes they've got a blemish that they want to get rid of, right? And then,
Mm.
you know, it goes on and on and on and on. So that's something that we need to be thinking about a lot. Is a big issue because people are also using, apart from hydroquinone, people use steroids to bleach their skin, right? And we know what steroids does to the kidneys, what steroids do to the bones, what steroids do to your stomach long term.
Mm.
So that's something that's quite heavy in my heart because I saw this study again recently. It's always been a thing, but someone's done it again and just released it and just opened up this wound in my heart all over again. Just hurt me.
And Dr. Yinka, you mentioned something, the psychology of it too is a big deal. I know that we're not talking about that here, but, loving the dark skin that you're in is very, very important. And, even passing that message that your skin hue is beautiful, whatever shade of brown, white, whatever. So loving your silhouette, that's what I call it. And it's much deeper than, sometimes the scars, sometimes the psychology of it is a big deal. And I'm hoping that for those who are watching, we encourage loving your silhouette, the skin you're in, your hue, and teaching that to our daughters and encouraging them is very, 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 very important. But thank you for highlighting that. That's deep.
So the other thing also that so there are for there is kind of a wide range. So we've talked about sunscreen. I've kind of touched on skin bleaching, but there's something like laser, for example. So you're going to have laser, and this person you're going to see to have laser done doesn't understand that for your skin, that the skin tone, that your type of skin matters, and the damaged skin permanently, right? When I was in England, I don't know if it's changed now, but when I was in England, in the clinic I worked in, I remember that the insurance would not cover laser for black skin
Hmm.
because it was kind of classified as high risk. So if you were doing it, you were doing it on your own. It was classified as high risk. So you need to know that this is how you treat black skin with laser. So
Okay.
if you've got skin of color, you need to be going to someone that knows. You have to ask specifically, do you know about the skin of color? Especially, do you have an ND-YAG laser, which is the kind of laser that's advised for black skin? You should be ready to go low and go slow. So you start from a low setting and go really slow because you don't want to damage your skin and live with something you didn't come in with. So that's one thing. Another thing is things like chemical peels, right? Chemical peels are amazing for skin,
Okay.
but once again, for the skin of color, you have to start at the right strength. You don't want to be diving in at the top because some kinds of peels need a prep. You need to prep the skin. You need to prepare the skin for weeks before you go in. So you don't just want to go in and do one of those, right?
Mm,
Um,
mm, mm.
and like I said about acne, because acne is the commonest skin condition in the world, right? So you need to make sure you start treating early because you don't want it to scar, right? You need to treat early. You need to go see your doctor, go see a dermatologist, depending on where you live, go see your family physician, your general practitioner, and start treatment, right? The earlier, the better. And avoid the sun if you can. I get a lot of hate, so I'm just dodging the stones thrown at me.
Oh my goodness, so fun having you here, Dr. Yinka. All right. Essentials of a face wash. Now, of course, this is medical advice. It's medical information. I'm sorry, I take that back. Medical information. Be sure to talk to your doctor or your specialist for personalized care. But the question is, what is an essential for a face wash? Like, how I'm going looking for a good face wash, what should I look for?
Okay, so your face wash depends on your skin and your type of skin, and if you're treating anything in particular. Okay,
Okay.
so I'll give an example of, let's say you've got dry, sensitive skin, right? You want a mild wash. You want something that would not strip the layers of your skin, that would not break your skin. It won't dry it further. It won't break your skin. So you want something really mild. So you would see things like either the Avenos or Cetaphil or CeraVe, E45, Dermo. Those are brands that have really mild washes. They just, all they do is they keep the barrier. Remember, your skin's the barrier, protects you from attacks from the outside. So they keep the barrier, they help to heal the barrier. If you've got dry, sensitive skin, that's a good one to start with.
Hmm.
Let's say you've got a dry, sensitive skin, but you've got hyperpigmentation that you want to treat. You've got really rough skin that you want to treat. That can be really difficult because the mild washes don't really treat anything. They just keep your skin intact. So
Okay.
you can try something like a papain or bromelain wash. And these are things that would say they've got papaya. They would say papaya wash,
Okay.
papaya. Those are kind of the common ones I see.
Okay.
Propane, bromelain, and they are kind of gentle exfoliants. So they would help to gently exfoliate. They won't be as powerful as the next step we're going to, but they would just help, and you would get some benefit rather than using kind of the mild wash for dry, sensitive skin. That's normal. Their problem is just that it's dry. It's not, they don't have dark patches or rough skin. And uh, then we go to something like you've got normal to oily skin, and you want or you get breakouts, and you have really rough skin, you've got some hyperpigmentation and your skin can take it, then you go to the hydroxy acid washes. So the hydroxy acids are like glycolic acid, salicylic acid. I find that salicylic acid is quite drying compared to glycolic acids, depending on the concentration. And then things like lactic acid is not as drying as glycolic acid. And mandelic acid seems to be like the gentlest of them all. So
you're dropping a lot of acids, man. And one second. So I have a question. Someone said, can you spell the second wash you mentioned in the second category? Right after the bromelain and the papain or something.
So papain is Papain, like papa in, Papain. And sometimes you see it as papaya. They would say it's a papaya wash, papaya the fruit, because it's an extract from the fruit, right? Bromelain is Bromelain.
Okay.
See, Dr. O, you didn't tell me I was coming for spelling classes.
You didn't tell me we dropping acids. Come on.
You could have warned me. What is this about?
Oh my goodness. And then someone's asking, because we went to the third category, we were talking glycolic acid, and someone's asking, hi, Dr. Tumor. She's asking what concentration of glycolic is best, would you say or suggest for hyperpigmented? And that's where you have extra dark, like darker spots, for hyperpigmented brown skin.
Yeah. So also again with glycolic acid, okay, so for example, Dr. Tuma, what I would say you can try is the DYS wash. Why don't you try that? But start with once a week. Start with once a week, then twice a week, then 3 times a week, and work up all the way to daily and see how you feel. Because it can be difficult to say, if you start with 2%, it might be nothing. It might not do anything. So what I say is, even if you get like 5%, or sometimes they have up to 10%, then just once a week and work your way up to daily. right? So the DYS one's got salicylic and glycolic acid in it, so that people that have really oily skin or the breakout, they find it really helpful. I've got a friend that's used it twice a day for years. She's used it twice a day for years. I can't tolerate twice a day of the DYS glycolic wash. I can't. It just dries out my skin. But for some people, it just works perfectly, right? So
Mhm.
why don't you try the DYS wash? Take that once a week on a Saturday, your self-care day, or maybe on a Sunday, whatever your pamper day is, as we all deserve one.
Mhm.
See what you think. Twice a week, 3 times a week, and work your way upwards. Because Dr. Tuma asked a very clever question. Glycolic acids are good for hyperpigmentation. They're good for dark patches. They're not usually sold as such, but they do help with hyperpigmentation because they block the pathway that produces melanin, not in as high a strength as hydroquinone, but they do really well with that.
Awesome. Lots of gems here, lots of gems, and I'm getting a lot of feedback. So this is good. Next, what are your thoughts on collagen? There's the powder, there are the shakes, there are the pills. What would you say generally about collagen use in whatever format?
I'm not convinced yet. I've got my eye on it and I've had my eye on collagen for a few years. I'm not convinced. And the
Yes.
reason I'm not convinced is that the collagen particle, they're quite big.
Okay.
They're quite big. So if you put it on your skin, they're bigger than the gaps in the skin. So they don't absorb, so they stay on the skin. If you eat them from your salivary gland to your gastric glands, I don't think anything's absorbed. It's all just broken down and thrown away. So I've had my eye on collagen for a while, and I saw a study, but it was a really small study, maybe like 100 people or so, saying there was some benefit. I'm like, okay, I'll just keep my eye on that. I am really not convinced yet. And if anyone's got studies about collagen making any changes, like proper randomized control trials, then I want to see, but I'm not convinced yet. They're too big. The molecules are big, and if you eat them as a protein, your salivary glands, your gastric glands just break them, and it's nothing.
Spoken like a true doctor. The RCT. Got to show me the proof. All right. So write that.
Show me the grade one evidence.
That's still debating. Okay, vitamin C, and I know that one of your products is the vitamin C serum for the face, which I love too. I didn't put it on this morning. That was my bad. But what would you say about the array of vitamin C, either ingested or topically?
Okay, so vitamin C, I absolutely love. Vitamin C was the first product. I don't know if you've heard that story of when I got into the industry, I had a meeting with a rep from one of the biggest companies, and the vitamin C is very expensive. Actually, Dr. Una knows about this vitamin C
Yeah.
because when I got in the industry, I told her, buy this one, is good. So she ordered it, sent me a picture. Look, I said, this is good. But I've converted her to mine. So, I tried that vitamin C and I got hooked on vitamin C. It works. Vitamin C serums work. And there's evidence, there is research. Like if you go and look them up, there's lots of evidence that vitamin C work. And they work in a range of between 10 to 20%. Some people say 5 to 20%. The DYS vitamin C is a 20% because if I want to hit you, I want to hit you hard. Let's go like
You look good.
let's go straight to the top. So vitamin C serums work. There's studies to say that when you eat vitamin C, this is where it becomes unfair. This is where the body becomes really unfair. You see, I'm here fighting for the skin and the heart and the liver and the kidney. They just steal my stuff. Like it's so unfair. When you eat vitamin C, all the big organs grab it. They take all those vitamin C. So you don't get enough to go to the skin from when you eat it because the big organs just want it and they take it.
Right.
But when you put it on the skin gets it first and the others can wait, right? And the others might get a little bit, but the skin gets it first. So that's kind of the thinking. But there are some studies to say if you take vitamin C tablets, if you load yourself enough, the skin will get some of it as well because
Eventually.
eventually,
Okay.
as a last card option. It's not fair. It's not fair. Stick to the kidney for me. It's not fair.
And I write real quick. I'll just interject. Kiwi is a very good source of vitamin C. Of course, your tangerines, your citruses. Okay, so get you
Yes.
some. All right,
Yeah.
awesome. This has been so informative. I know we're supposed to be 30 minutes, but I still have more questions, so bear with me. Okay, any tips, real quick? I know you talked about it before, but in summary, how to care for your skin from the inside out. What would you say? Let's say 4 or 5. Like, how, doc? How do I care for my skin from the inside out?
Okay. One, sleep well. Get good sleep. You know how you wake up and then people are like, oh, you look tired. I've told you people are going to judge you based on your skin. And the more people love you, the more they judge you based on your skin. Like, I've got people come in my office, shut the door. Oh, you look a bit, today.
The more people love you, that is so true. Hey,
It's so true.
yeah,
Hasn't your mom called you and said, oh, Tolu?
we're not going there. Yeah, I don't like the FaceTime. Like, all right, let me just convert to just let's just talk because
so 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 you sleep well. Sleep's good.
well.
Sleep is really good. You look relaxed, you feel relaxed, the brain's happy. When you wake up, you try and get some exercise if you can during the day. That's another tip. Use a good cleanser. We've talked about cleanser. We've talked about washes, the range that's good for you. Use a vitamin C serum if you find that is good for you. There's also another one called niacin, which tends to be quite good as well. It works about the same range as what vitamin C would do. Use a sunscreen. Make sure you eat healthy. 5 portions of fruit and veg. I am a bit. I'm and I'm a bit that's one of the things I love about moving to North America, actually, the range of salads. Like, you just get a bigger range. Like, you go in the store for lunch, and there's just a huge range of salads you can just grab and enjoy. Like, they're really, really tasty as well. So fruit and veg, drink, stay hydrated. Water is the best thing that hydrates you. It hydrates you better than coffee, tea, juice. And water is the best. How much water? I don't know, because a big, tall, 6'7" man cannot be getting exactly the same as a me 5 foot nothing woman. If you live in the deserts of the Sahara Desert, you cannot be getting the same fluid as someone that lives in the tropical rainforest. So sometimes they say drink to thirst and a bit more, but know what works for you. Stay hydrated, drink water. If you can and you're able to, have a nighttime routine, right? Wash the day's grime off your face, the dirt, the pollution. You've been out in your car, people have pumped the exhaust fumes on you, you've touched your face, all kinds of worry, and make it an enjoyable thing. Touching your face is like a hug, isn't it? Touching your face.
Music, why you do it?
Yeah, it's maybe not hip hop, Dr. O, not everyone. Some people like classical music. It exists.
Yeah, whatever rocks your boat.
Yeah. It's not always like that. Yeah, sometimes, you know.
You are a man.
Have a nighttime routine, wash off the day's grime, put on some nighttime cream, retinol. Some people like a moisturizer. I haven't talked about that, but some people like it. It might be for everyone, might not be for everyone. I'm not in the school of thought that says everyone needs a moisturizer. I don't belong to that school of thought. So to have a nighttime, wash it off, put something soothing for the night, put some retinol if you want actives to fight lines and wrinkles, to fight breakouts, and just make your life as simple and as effective, efficient as possible. I like efficiency.
I concur. Dr. Yinka, this has been so awesome. But my guests are watching, they're like, all right, we get it. Where can we find this awesome doctor? Where can we find her products? Dr. Una was kind enough to put it on earlier, the website. But where can people, if they want to connect with you and say, Doc, I want you to come talk, I want to know what your website is and where I can find you, what would you say?
So I'm on Facebook as Dr. Yinka Skin. I think if you even did a Dr. Yinka on Facebook, you would find me. But my Facebook page is Dr. Yinka Skin. On Instagram, it's the same, Dr. Yinka Skin. Those are the two I tend to use. But I also have a TikTok page, Dr. Yinka Skin, and I have a Twitter, Dr. Yinka Skin. And it's very easy to find me. I am quite responsive on all the platforms, and Facebook seems to be my best because I tend to go in at least once a day to look at Facebook. So that's where it's easiest to find me. I have a whole load of videos on Facebook on different topics, so you can just look through the catalog, see what you want to watch it, hit me a reply, send me a message. And the website is dryinkaskin.com. That's where
That's
the
doctor with a DR, just so people like
DR
okay.
DRYINKASKIN.com.
Right, awesome. And I'm putting in all those details. And I love how you have all your names the same: Facebook, Instagram, Twitter, and LinkedIn. All right, awesome. This has been awesome. I've learned a lot, and I'm sure people who are watching have learned a lot as well. Thank you, Dr. Rondo. Nice to see you as well, Dr. Mitra, Dr. Una, Dr. Jesse, Dr. Jessica Dago. Thank you all for stopping by. This has been great, Dr. Yinka. You are phenomenal. I had fun. We got to laugh, and this is good. So thank you so much for coming. We're gonna have you again. I could bet we could do a part 2, and we'll re-ask that question on collagen, and we'd like to see what you think at that time.
Send me all the studies. If you've seen studies about collagen, send them to me.
I will go look. I'll go look, and I'll chat you up. I'll chat you off. But thank you all for coming. This has been good. Once again, this is the voice face of Dr. Tolulope Olabintan of Livingspring Family Medical Center. If you or anyone you know is looking for a thorough, a passionate, and caring family physician in the Mansfield, Texas area, I am she. And thank you, Rebecca, for joining. This has been good. Thank you, Dr. Yinka. You are awesome. Have a good one, ladies and gents.